Good morning. Welcome and thank you for participating in the fourth of our Leader Talk series, Leading Your Employees Through the Battle with COVID-19. My name is Keith Sipe. I am Director for Business and Industry Services at Catawba Valley Community College. Working in collaboration with K64 in the Chamber of Catawba County, our goal over the past several weeks has been to provide business leaders throughout our community useful information for both you and your employees as you face the challenges brought on by the coronavirus. If you're like me, we're all ready to begin working to safely reopen businesses to get back to some definition of normal as soon as possible. So I think you will certainly find our fourth Leader Talk, Life with COVID-19, very useful and informative. In our fourth Leader Talk, our guest speakers from Catawba County Public Health will share steps you should take in protecting both your employees and your customers. Keith Mackey, Executive Vice President here at CVCC, will introduce today's Leader Talk and our two distinguished speakers. Following Dr. Mackey, each of our guest speakers will share directives from Catawba County Public Health in reopening our. Then Jennifer Jones, Business Liaison with K64, will open the floor up to Q&A. Please use the Q&A function in the WebEx to submit your questions. In closing, Cindy Fulbright, Program Manager for CVCC's Furniture Academy, will share our focus for our upcoming Leader Talks later this month. With that, Dr. Mackey, thank you for being here this morning.
Thank you, Keith. I appreciate the opportunity to be here. And on behalf of our president, Dr. Henshaw, and our faculty and staff, I welcome you to our Leader Talk series. This is the fourth Leader Talk series that we have put together. We would also like to express our appreciation for everything that you're doing to keep our community healthy and productive. During our Leader Talk today, Life with COVID-19, our speakers will highlight the steps you can take as your employees return to work. Although we are moving through a phasing in process, COVID-19 is still with us and unfortunately will be most likely with us for some time. So as we return to our workplaces and our normal life, we want to be as safe as possible in our places of work. So we're very fortunate to have two outstanding community leaders with us today, Huni Estrada and Casey Morgan. We are appreciative of their time today and for their commitment every day to make our community a better place for everyone. Huni and Casey, we know that you have been extremely busy during the pandemic, providing the support, expertise, and guidance that we need to keep our community safe, healthy, and productive. And we applaud you for our efforts. Huni and Casey are with the Catawba County Public Health Department, and we are grateful for their time today. So Huni and Casey, thank you for all that you're doing during a very challenging time. A little bit about these two speakers. Huni Estrada is the Catawba County Public Health Strategist. Her mission is to make Catawba County a healthier place to live, learn, work, shop, play, and pray. She works with a number of community partners to identify needs and to develop initiatives and action plans designed to improve community health. Passionate about health and wellness, Huni holds a master's degree in public health from Lenore University. Huni lives in Newton with her husband and two teens. And joining Huni today is Casey Morgan. Casey is a registered nurse with Catawba County Public Health. She is the lead communicable disease nurse for Catawba County and comes with years of prior nursing experience in pediatrics and geriatrics. She is currently working on continuing her nursing education at Ryan University. Casey is a Catawba County native and is now raising her own family in this community and looking for ways to give back to her hometown. So Casey and Huni, thank you again very much for being with us today virtually and for sharing your insight and guidance with all of us. Thank you.
There we go. Thank you. Thank you for having us. We are very excited to be here and just appreciate the opportunity to share a little bit about what public health is doing with you all. I like to celebrate wins, and so that is something that I really enjoy doing before we move into the content. And so one thing that, of course, I am extremely grateful for is the work that you all are doing in your respective spaces. This is new for all of us. It is definitely new for us here at Public Health. And, I think that as we look at kind of the community response, that is one thing that I am very grateful for, and just applaud our community for the efforts that we have all made to come together to combat COVID-19. I think just, being able to look at all the partners and how they're responding. We're looking at, from schools providing lunches, folks just being there to support each other. I am just very grateful to be a part of this community. Thank you all for the work that you are doing to keep our community healthy and safe. We certainly appreciate all of you. So we wanted to open up a little bit by just providing some of the most current stats. And so a couple of weeks ago, we developed a dashboard that is available on our website, the county's website, and that information is updated every day by 2 p.m. And so just kind of a rundown of the current stats right now. We currently have 65 total cases, 1,019 negative test results, 38 individuals have recovered. We have 4 hospitalizations and 1 death. We compare that to the state, we currently have 12,200 total cases and 151,800 completed tests, 534 hospitalized, 452 deaths in 99 counties. And if you compare that nationwide, we have 1 million cases in the US and over 67,000 deaths. And so ask, what is public health doing about that? And so we want to share just a little bit about our response from not just public health, but for the county. So right now, public health and emergency management, we are in unified command. Karen Yalsey and Brian Blanton with emergency management, they have moved in with us. And so we are operating our incident command. They are here living with us right now, and just very thankful for their guidance and for their support. We're working alongside with them every day. We have activated our EPI team, so our epidemiology team, which consists of it's an interdisciplinary team. So we have several individuals serving on that team, several different disciplines, and they all bring with them their skill set that really kind of helps to support our response as we tackle all things COVID-19. We have been since, I would say, probably late December, early January, since we first started hearing about COVID-19. And earlier this year, probably about Marchish, before mass gatherings were banned, we had several community meetings at our Emergency Operations Center. So we met with county leadership, we met with schools, we met with childcare facilities, long-term care centers, we met with the faith communities, just to provide some education and to prepare folks for what was coming, and so, and again, I think Casey and the team through communicable disease, they have been working tremendously as we prepare. And, once we got that first positive, the efforts that they to really try to keep the folks in this community safe and healthy. The school nurses, you may be asking, what happened to the school nurses? As you all know, the schools have been closed. And so our school nurses have been deployed in different roles. So they are right now working to man our triage lines. We have placed our school nurses in areas to provide education. So they have been a tremendous resource for us. And it's been nice to see them here at Public Health, because they're usually out in the field at their respective schools. And environmental health, which plays a tremendous role too in public health. They have been working very closely with restaurants, with facilities to provide advice and to guide them on the current recommendations for cleaning and sanitation. Again, keeping our community safe and healthy. Emergency management has been working very closely with on a broader level with several community partners to make sure that we are prepared for a number of response. And then, we have our lab coordinator and our preparedness coordinator who are working with hospitals and health systems to make sure that we have the most current guidance when it comes to testing, making sure that we're prepared. We have our community outreach staff who is working on communications, who is addressing public health concerns, and addressing emails, answering phone calls. And so, I just really applaud the efforts of this team who has come together to really support the community and making sure that everybody is safe and healthy. We are also participating in weekly calls that are led by the state. And so every Tuesday at 1 o'clock, we participate in those calls. And that is a call with all local health departments to make sure that we are abreast of the most current guidance and the most current recommendations. And in addition to that, we're also participating in weekly calls with our partners, so both health systems, to make sure that we are operating in unison, because this is certainly a team effort. And so just wanted to share a little bit about what we have been doing here at Public Health. And so, in your areas, what we want to make sure you are aware of is, in your spaces, if there's a positive, what happens? And so I'm going to hand it over to Casey to talk a little bit about contact investigation and what that process looks like.
Hey everyone. So the hot word of the day most days is contact tracing, and lots of people have had questions about what is contact tracing or investigations, and exactly what is that process like. And so I wanted to provide just a little bit of insight into how that works for us, and how that really works for you guys. So contact tracing is the process of identifying contacts of a person who has tested positive for COVID-19. So it allows us here at the health department and as part of the CD or communicable disease team to determine if that person exposed is symptomatic. So are they sick? Could they also be positive? And it really helps us to understand the spread of disease and rapidly identify those people who may also have COVID-19. In doing contact tracing, it allows us to implement control measures. And what those are really just ways to limit the spread of disease. And so by doing contact tracing, and that's something that we've done really from the beginning of this whole process, it really just allows us to have a better hand into the pot there, and have a better handle on things, and limit that spread of disease as much as we can, and certainly prevent additional exposures. And that's one of the bigger goals of what we do. And so I'm sure you've heard lots of talk about contact investigations and these key metrics that Secretary Cohen with the State Department of Health and Human Services, as we plan to reopen. It's one of those things that everyone wants to know. And when can we open? When can we go back to business as usual is kind of the talk here. So knowing when to dial up or dial down social distancing and those other precautionary measures that we're also familiar with really depends on two key factors. So trends in those key metrics that the state has come up with, and the capacity to conduct testing and contact tracing. So it really is this huge, really it's a web of how we plan to reopen, and very much everything that we do is guided by CDC and the North Carolina Department of Health and Human Services. So Huni had mentioned that we are in on these weekly calls, and so just to give you a kind of a back picture there to help make decisions and what guides our practice here. So those measures that Secretary Cohen has been talking about so much, I'm just going to hit kind of the highlights on those in case you haven't been able to see or tune into those. It seems like daily updates. So part of that bit is the state wants to see a continued downward trajectory of COVID-like illness with the use of surveillance. And that can be done with several different surveillance systems that the state's been using for a long time. We use several different surveillance systems here in our health department, big overarching surveillance systems that the state uses. So they're wanting to see a downward trend in how many people are getting sick. In addition to that, they want to see that continued downward trajectory over 14 days or sustained leveling in new cases. So everything that we are going to do is very much data driven and based on science and really just allows us a better sense of are we making the right decision? We don't, of course, want to open too early, overwhelm the hospitals, expose additional people, that sort of thing. Another bit that we are focused on is a downward trajectory over 14 days of positive test as a % of total test. So how many of those tests that are completed are truly positive? And that's where that surveillance system bit really comes into play. We're able to pull the data from there, and these surveillance systems receive information from all of the major hospitals, laboratories across the state. And so although they won't receive every single test result, they do receive a large majority of them. And that's where that information is coming from. They also want to see a downward trajectory over 14 days in number of people hospitalized. I am sure that is easily understood that, you know, how many people are really having severe illness that requires hospitalization. And again, contact tracing. So the state is working with partners across the state in really increasing our capability for contact tracing. So across North Carolina, there are 250 contact tracers that are housed in the health departments across the state. So they are actively in the process of recruiting and onboarding an additional 250 contact tracers to be able to expand that effort. And then another very important bit of all of this is an increased supply of personal protective equipment. So all of these things really work together to be able to reopen our state safely. And that's kind of the back picture to how we can get back to a sense of new normal. And so there are 3 different phases that Secretary Cohen has been discussing, and I just wanted to, again, hit the highlights of those for you as well. Sometimes it helps to hear things over and over and let it sink in. So phase 1, that's kind of where we're at right now. So the stay-at-home order is still in place. People can leave home for commercial activity, not recreational, commercial. So those retailers and services will need to continue to implement social distancing, cleaning, other protocols to prevent spread of COVID-19. Gatherings of no more than 10 people. Parks are open subject to those gathering limits. Face coverings are recommended when you are out in public, whether it be these masks that you see people wear, respirators, cloth face coverings. There's a wide gamut out there of things that people are wearing for prevention, and encouraged continued use of teleworking. So like most of you guys are, meeting as remotely as you can and not face to face. So that's phase 1, and that's where we're at. And I'll go over phase 2 and 3 as well. And just keep in mind that this is going to be over a period of time. It's, as much as we would all love to go back to normal, it's something that is not going to happen within the next week. It's really a wide picture of how to do this as safely as we can. So phase 2, we're looking at least 2 to 3 weeks after phase 1. And so that's where we're moving. That's where we would like to be next. So that would be being able to lift that stay-at-home order. with strong encouragement for vulnerable populations to continue to stay at home. Limited opening of restaurants, bars, other businesses that are able to follow strict safety protocols, allowing gatherings at houses of worship, entertainment venues at a reduced capacity. So again, keeping in mind that there are still going to be limits on how many people can gather together. The goal would be to increase the number of people that can be together and to open public playgrounds. And so after we meet all of those key metrics that I initially discussed with you guys, we're going to be able to move between these phases. Phase 3, the timeline that we have been given is 4 to 6 weeks after phase 2. So again, over a wide range of time, it seems. Phase 3 is really more about lessening those restrictions for vulnerable populations with the encouragement that they would still continue to practice social distancing, increasing capacities at restaurants, bars, other venues, houses of worship, businesses, those kinds of things, and to further increase the number of people allowed at gatherings. So it's going to be very similar to what we've already experienced. You know, we started out at gatherings of 100 people, gatherings of 50 people, gatherings of 10 people. Yeah. It's going to be flipped. So going back to normal is going to be a reverse process. And so with all of those key metrics and increased contact tracing here at the health department, rapid identification of cases of COVID-19, it is just going to be a process. And so that's something that we are very much here for support and guidance to you all as you gear up and get ready to go back as well. And so I'll go over just a few of the recommendations, cleaning and disinfecting as you prepare to reopen. And these are all available at CDC's website and NCDHHS. I'm sure you can find some of these things at ours as well. Yeah. And so just know that these are all the most up-to-date recommendations, guidelines, things very frequently. So as soon as I say it could change tomorrow. So
no, this is current as of, I think, like
this morning.
Yes.
So just be aware that you can go to these websites and get the most recent. Say next week you have a question, you can go to these sources that are credible and get the most accurate information that you would need. So for our recommendations, of course, we want to continue to practice common sense habits. I won't dive deep into that one, but of course, good hand washing, not touching eyes, nose, mouth, those kinds of things. And so within your individual respects, you want to really plan to develop your own plan of how to do these things, how to clean and be as safe as you can. So you would determine what needs to be cleaned. Some surfaces only would need to be cleaned with soap and water. Some surfaces and objects would require disinfection. And so there is a difference between cleaning and disinfecting. Things that you would not want to disinfect, say with one of those higher level cleaners, would be objects that, say, children, especially young children, are more likely to put in their mouth. Disinfectants are more of those harsher cleaning products that you can't necessarily put on everything. And there's an entire list of these cleaners that are available that are EPA registered and recommended for use on the CDC's website as well. That's one of those bigger questions that we've heard and seen over and over is, well, what should I clean with? And so that is certainly out there, and you can kind of run through that list and see what exactly should be cleaning what. So in determining your plan, determine what needs to be disinfected. So these would be things that are frequently touched or high touch surfaces and objects. So tables, doorknobs, desks, phones, keyboards, all of those things that you really don't pay attention to how much they're touched.
Light switches,
pins, yes, common items. Anything shared, those are things that you want to disinfect frequently. So even after, say, Honey and I are sharing a computer today, well, I hope that never happens, but we would clean it every time that we are changing off who's touching these things. So also want to consider what type of material you're cleaning. So hard and non-porous materials will be treated very differently than soft porous materials like carpets or seating areas. So it certainly depends what you're cleaning and how you do that. You also want to consider the resources and equipment that you need and keep in mind the availability of these products. As we prepare to go back, I know everyone is going to be eager to have all of these things hugely on hand, and really you only need what you need. So would not recommend at all stockpiling these things, and that's something that we've all experienced and seen if you have been to the grocery store. So again, have what you need and no more than that. And so another bit about cleaning and disinfecting is, aside from being aware of what you're using, but how to use it. So you want to read those labels on these products. Really follow the instructions on there, especially, if you should have gloves on while you're using this product, or how long does this product need to remain wet on a surface before you can wipe it off. And so that's a contact time. So these cleaners will reference a contact time, and that's what that means is how long does it need to sit before I can wipe that off. When you move to implementing your plan, you want to clean visibly dirty surfaces with soap and water. Soap and water is one of those things that is usually always going to be the very best thing to start with. It's been around much longer than all of these cleaning products that we are so dependent upon sometimes. So disinfection, you would use the EPA approved disinfectant and read your labels, follow those directions at contact times. So as you move to maintaining, revising your plan, you want to continue routine cleaning and disinfecting. Have a process. How often am I going to clean these things? Or who is going to be in charge of cleaning this area? Continue your routine cleaning, have a good plan, and maintain safe practices. So washing your hands, using facial coverings, staying home if you are sick. Consider any kind of practices that can reduce the potential for exposure. So maintaining social distancing, reducing sharing of common spaces like break rooms, lounges, those kinds of things. You want to continue to encourage social distancing and overall just frequent cleaning of these high volume areas. So that is all that I have to touch on.
Thanks, Casey. And so we wanted to also just give you guys some guidance in regards to where to get your information. Sorry, we're being paged. So we've referenced these a couple of times, these websites a couple of times, and I know that Jennifer Jones has added them also. I've seen the chat light up a little bit, but those kind of credible sources, we know that there is a lot of stuff on social media. The memes are funny. They make me laugh. But I think that if we are looking for current guidance, we want to stick to those credible sources. And so for us, the CDC and North Carolina Department of Health and Human Services, that is where we go to get our guidance. We visit those sites every day.
All day.
Every day. So they are up on our computers and they are referenced every day. And then of course, our favorite is Catawba County Public Health's website. And so we have a whole team that is dedicated to making sure that the most current guidance is included on there. So we do invite you to come and, or even on Facebook. So Public Health's Facebook page, if you have not liked our page, feel free to like our page. We push out information there as well. And so we do encourage making sure that you're getting the most current and the most credible information from those sites. So that is it from us. And I think now we are going to open it up for questions.
Thank you, ladies, so much. That was very helpful information for everybody that's with us today. We thank you so much for taking your valuable time to share that with us. We do have several questions coming in, so I'll start reading some of those off and let you ladies provide answers for those. The first is there a place to get COVID-19 signage for the workplace?
There is. So it's the CDC. Yeah, the CDC, they have lots of signage and you can go and explore everything that they have on there. Lots of great resources there.
Great, perfect. All right, and then does my business need any documentation to continue operating?
And so it's kind of like that honor system, and if you read the executive order, and I can't remember off the top of my head which one it is, but if you read the executive order, it's very detailed and it states very clearly what businesses are deemed essential. And if you believe you are essential and you're not on the list, then you can contact the Department of Revenue, so the North Carolina Department of Revenue, and they will have guidance on those steps you need to take to ensure that you are an essential business.
Perfect. What if my business is not listed as essential and I cannot conduct business operations and maintain social distancing between employees?
So it's kind of that same thing. We're going to lean heavily on that guidance to tell us what we need to know. So always referencing what those recommendations are from those credible sources.
Okay, and I'm sorry.
Yeah, I have a bit for you about not being able to maintain social distancing. So there are, of course, lots of essential critical care workers that cannot maintain social distancing. And so in that regard, you would certainly want to stick heavily to the recommendations of continued face coverings. So, and of course, cleaning measures. So provided that everyone is following those kind of recommendations, it does offer some kind of protection there.
Perfect, great. Another question, where are the testing locations in the Hickory area?
So right now, I think the primary care physician offices are responsible for testing. And so going back to and we have been in contact with them. We have provided guidance for them. And so making sure that you stay in touch with that primary care physician to get testing.
Okay. Another question, what is the recommendation now for people to quarantine if they have been near someone who was positive? We had an employee whose wife was positive and he was told he could not get tested. We need to determine how long he needs to stay out.
Yeah, so as we gear up towards increased testing and really amping up as a state contact tracing, there's going to be, of course, additional recommendations and guidelines that may come down the pike. So currently, the recommendation would be that if you are a close contact to a confirmed case, you would be quarantined for 14 days at home. You would want to stay out from work for those 14 days and monitor for symptoms. So we recommend here at the health department that they check their temperature twice a day, monitor for those symptoms of COVID-19. And so are they having fever, cough, shortness of breath, muscle aches, sore throat, all of those kind of things that have been spelled out for us. So he would stay home, monitor for symptoms. If he develops symptoms, would want to call his doctor.
Okay, great, thank you. Are we able to have residents come back to our group home if they have been visiting family for the last month?
So there are specific guidelines for allowing residents of a facility to come back into the facility after they've been somewhere. That's available on CDC as well and NCDHHS websites. So I would recommend that they go ahead and do a 14-day quarantine as well. So make sure they're not having symptoms, keeping their distance away from others, that sort of thing.
If my business was previously required to close under an executive order or a local stay-at-home order, are there any circumstances under this order that would allow me to reopen?
I don't think so. Yeah.
I think you have to follow the executive orders.
We have to follow the executive orders.
Okay. Our members are in phase 1, the way presented on the news and in general phase 1 was triggered when announced.
So that's what we are waiting on and very much following those guidelines and recommendations from the state. So I know there's another update today after 5, or at 5 rather, it's after our workday. But so I imagine they'll have new information for us this week about where exactly we are at.
Very good. Where can I report a business that is operating in violation of the order?
So what we recommend, of course, is talking with that business directly, of course, and checking with them to see if they have done everything that they need. There are a lot of times when we receive reports that a business that is not essential is operating, and usually, we refer those individuals back because they may be essential and they may have the appropriate documentation to support them. So of course, just checking with them to make sure that they truly are essential and that they do have the current documentation to support that.
Very good. One more question. What if I still have to go to work?
Then
There are certainly people that would still have to go to work. So, and that their job is one of those critical jobs listed by CDC and DHHS. So there's a whole separate criteria of people who may have a little bit different guidelines and recommendations for returning to work or quarantine process. So it very much depends what you do sometimes. But regardless, if you are symptomatic with COVID-19, then you would not be going to work.
And I would recommend very heavily to discuss concerns with your supervisor or your HR department. Usually we understand people are scared. We certainly understand that. And so I think that in those times, communication is so important. And so just communicate very clearly and very transparently what your emotions are. If you're scared, then say, I'm really scared, or, I don't want to take anything back to my family. If you communicate that to your supervisor or to your HR department, I'm sure that they will work with you to develop a plan.
Good advice. Keith or Cindy, do either of you have a question for these ladies?
I do. I was wondering, with all the people that are wearing the gloves, the latex gloves out and about, and also in the workplace, what is the recommendation? You hear that you should be washing your hands, keeping your hands clean, and then you find these folks disposing of those gloves in an improper manner as well. So what is the recommendation for that?
So that is not one of our recommendations here at the local level, nor is it anything that I've seen recommended by the state. So cloth face coverings or masks, yes. I think regardless of what level of protective equipment you are using, you want to use it properly. So certainly discarding where it needs to go, and really thinking about hand washing and these things and how you remove them. You are more likely to have an exposure if you are using these things improperly. So does that answer your question?
Yes, I think so.
All right. Well, ladies, you have shared some invaluable information with us today and answered lots of really good questions. And we are so grateful for your service each and every day at Public Health and for the way that you're caring for our community members. We thank you so much for the information you've shared with us today. We thank you for sharing your time with us. And to all those of you who have joined us today to listen in and hear this great advice, we appreciate you sharing your time with us as well. We thank you for being a part of our Leader Talks. And Cindy's going to take us out and share a little bit about what's coming up next.
We certainly do hope that you found today's Leader Talk helpful as we work through the process of opening our businesses. We thank our guests from Catawba County Public Health, Huni and Casey. Y'all did a great job, and thank you for sharing with us. As the COVID-19 situation progresses, we plan to host the next Leader Talk later in May, sharing information that we'll hope will be beneficial to your businesses. We thank you for participating in our Leader Talk today, and we hope to see you soon. Thank you so much.
Bye, guys.
Bye.
Thank you.